Head, neck, and back injuries are serious enough when they happen on land, but when they occur in the water, you've got to respond right away. If the victim isn't able to move and is face down in the water, there's no way to breathe. You have to get there fast.
If you suspect a head, neck, or back injury, follow these general rescue procedures. Activate the emergency action plan, assess the victim's condition, enter the water safely, and perform an appropriate rescue. If possible, move the victim to shallow water. Check for consciousness and for signs of life. Remove the victim from the water and give emergency care as needed.
There are two different techniques we use to stabilize a victim's head and neck in the water: the head splint technique and the head and chin support. We'll start with the head splint technique for a victim who is face up in shallow water.
To perform the head splint technique for a face-up victim in shallow water, stand behind the victim's head and submerge so the water level is at your neck. Grasp his arms midway between the shoulder and elbow. Gently place the victim's arms alongside his head and squeeze them together. This helps keep the head in line with the rest of the body. Reposition yourself to the victim's side as you secure the head with his arms. Position his head close to the crook of your arm, making sure that the head remains in line with the rest of his body. Maintain the victim in this position until help arrives. Check for consciousness and signs of life.
If a victim is face down in shallow water, you can also use the head splint technique to turn her face up. Approach the victim from the side. Grasp the victim's arms midway between the shoulder and elbow. Place the victim's arms alongside the head and squeeze them together to keep the head in line with the rest of the body. Glide the victim slowly forward. As you move, rotate the victim toward you until her face is out of the water. Position the victim's head close to the crook of your arm, making sure that the head remains in line with the rest of her body. Maintain this position in the water until help arrives. Check for consciousness and signs of life.
The other technique used to stabilize an injury to the head, neck, or back is called the head and chin support. If the victim is face up, approach from the side. Lower your body to about shoulder depth in the water. Place one of your forearms along the length of the victim's breastbone and grasp the lower jaw. At the same time, place your other forearm along his spine and grasp the back of his head. Squeeze the forearms together, clamping the victim's chest and back. Hold the victim face up in the water until help arrives. Check for consciousness and signs of life.
If the victim is face down in shallow water, you can use the head and chin support to turn him face up. Lower your body to about shoulder depth in the water. Place one of your forearms along the length of his breastbone and grasp the lower jaw. At the same time, place your other forearm along his spine and grasp the back of his head. Squeeze the forearms together, clamping the victim's chest and back. Move forward and rotate the victim toward you as you submerge. Maintain inline stabilization as you roll slowly under the victim. Surface on the other side, bringing his face out of the water. Keep him stabilized in this position until help arrives. Check for consciousness and signs of life.
If the victim is in extreme shallow water, such as in a zero-depth pool, modify the head splint technique like this. Approach from the side. Grasp the victim's right arm with your right hand and his left arm with your left hand, and move the arm slowly and carefully into position until the head is secure between the victim's arms. Roll the victim toward you as you step from his side toward his head. Lower the arm closest to you so the victim's arms go over the top of your arm as you move toward the head. Maintain pressure against the victim's head during this maneuver to minimize movement of the head and neck.